Doc McGee here to talk about concussions. So, concussion management has changed a lot just recently, even in the last like 5 to 10 years. So now we look at trying to create a gradual return to activity and talking about how we don't do the whole dark room for a week anymore, where you just kind of shut off the lights and stare at a wall for a week. We do more of the gradual return where you limit activities. Like you can still watch TV, but try to watch less of it and try to slowly return and managing your symptoms more effectively. So saying, if I watch TV or I play on my phone for an hour, does that cause a headache? Does that cause symptoms? If it does, then try for a half hour instead of an hour and see. And like trying to manage the symptoms that way, similar to how someone with shoulder pain, well, does it hurt to lift your arm overhead? Well, then it's probably a good idea to try not to lift your arm overhead for a little while and let it rest. That hurts. Similar with concussions and the healing process. For the physical therapy side of it and what PT or myself could help you with for anyone that has suffered a concussion, there is a rehab protocol set aside. In a PT setting, we're going to look at the symptoms of the concussion, and oftentimes one of the symptoms of concussion is lightheadedness and dizziness and having issues with your vestibular and your visual stimuli. So you're going to have issues where we can work on trying to help with that dizziness and like vertigo type symptoms. And then on another side of it, oftentimes most concussions will have something happening in the neck where you have like a whiplash incident, like a car accident, or you're an athlete and you get knocked to the ground, your head gets knocked back. Those types of things can occur and are very often with concussions. So you're going to have like the main problem is going to be that brain is bruised and it needs to heal, but you're also going to get this stiff neck. You're going to get some muscle spasms in the neck and that mid back, and you might even develop some shoulder problems that are just radiating from that neck. Well, we got to attack those, and that's something that PT can absolutely help with, and something that I have a fair bit of experience in helping with. That is my little talk of today. I will post a short little article and a link that talks a little bit about what I just mentioned here. All right, Doc McGee out. Bye.